In a world where misconceptions and myths surrounding depression persist, hindering individuals from seeking the help they need, this video aims to unravel the truth. Join us on this insightful journey as we debunk common myths and shed light on the stark realities of depression. There is a high global prevalence of depression, with approximately 300 million individuals grappling with this mental health condition. Estimates suggest that about 15% of the adult population will experience depression at some point in their lifetime. There are many myths about depression that exist today, despite the fact that depression facts and statistics are readily available. In the pursuit of mental health awareness, we present 12 prevalent myths about depression. Stay tuned, as understanding the truth can be a pivotal step towards fostering a more supportive and informed society. Myth number 1, depression isn't a real illness. Depression is not just a temporary bout of sadness, but an actual mental illness. Myths stating that depression is not a real illness contend that depression is just a simple case of the blues. However, depression is a multifaceted condition that is caused by a combination of biological, environmental, and social factors. Depression is a mood disorder that impacts a person's thoughts, emotions, and actions. Depression causes a significant amount of distress and impairment in an individual's day-to-day functioning, leading to a considerable amount of emotional, social, academic, and occupational difficulties. Depression may require long-term treatment and is not always easy to overcome. Myth number 2, depression only affects women. The misconception that depression only affects women suggests that depression in men is non-existent, which is untrue. Men may not be as likely to admit or report it due to social pressures. Social and cultural norms make it difficult for men to show vulnerability, discuss their feelings, or reach out for help. Some men fear that admitting depression will make them appear weak or less masculine. Thus, men are not as likely to identify their symptoms, discuss their struggles, or access treatment. Depression in men also presents differently, as men tend to display angry, irritable, and aggressive symptoms. Men are also more likely to engage in risky behaviors and can potentially go on to develop substance use disorders. These factors can make it challenging to diagnose depression in men. More than 6 million men in America experience depression each year. Depression can have significant consequences for men, as they are more likely to commit suicide than women. The suicide rate among men is nearly 4 times higher than the rate for females. Myth number 3, depression and sadness are the same. When comparing depression versus sadness, it is important to take into account duration and resolution of symptoms. Feelings of sadness do not last as long as a depressive episode, which can potentially persist for weeks, months, or even years. Feelings of sadness tend to resolve on their own, especially with the passage of time and support of family and friends, while depression does not go away on its own. Individuals who are SAD only experience feelings of sadness, while those with depression tend to experience several other emotions, including anxiety, emptiness, and hopelessness. Myth number 4, if your parents have depression, you will too. While it is true that depression has a genetic component, it does not necessarily mean that children are destined to develop and experience depression like their parents. Yes, depression is genetic, but heredity appears to impact a person's risk and susceptibility more than the actual development of the condition. While it is practical to be aware of family history, it is not sensible to dwell on it. Focusing on factors that lower the risk of depression, such as avoiding substance use and practicing self-care, is a better use of time and energy. Myth number 5, antidepressants will change your personality. While antidepressants do impact the chemicals in a person's brain, they have no impact on personality. Antidepressants target specific chemicals linked to depression and do not alter the brain chemistry that is linked to personality. In fact, many people who take antidepressants report the medication helps them feel more like themselves. Myth number 6, you'll need medication the rest of your life. While antidepressants are often used in long-term depression treatment, these medications do not always need to be taken for the rest of a person's life. There are many depression treatment options that vary depending on the severity of a person's depression. The length of time a person is prescribed antidepressants is dependent on their individualized treatment plan and the acuteness of their depression. In conjunction with medication, psychotherapy may be prescribed as another course of treatment for depression. Therapy can educate and help equip a person with coping mechanisms to manage depressive symptoms. Acquiring new coping skills may potentially lessen the need for medication. However, in other instances, taking antidepressants in conjunction with therapy may be clinically recommended. Either way, there is no evidence to support the claim that you will need medication for the rest of your life. Myth number 7. Talking about depression makes it worse. Talking about depression is encouraged to help a person to overcome symptoms. People who suffer from depression can feel like a burden to others, and silence often perpetuates the negative stigma of mental health conditions. Talking about depression with friends, family members, or mental health practitioners can help people struggling with depression feel they are not alone. Myth number 8. Depression is only brought on by a traumatic event. The exact cause of depression is unknown, but it is thought to be a combination of biological, genetic, and environmental factors. While traumatic events can trigger depression, they are not the only risk factors. Depression can also occur without cause, even when things seem to be going well in a person's life. If a traumatic event occurs to someone already dealing with depression, it will likely intensify their symptoms. Myth number 9. Depression will go away on its own. Treatment is necessary in order to address symptoms of depression. It is very rare that depression will go away on its own without intervention. Without obtaining treatment, depression can persist for months or even years, or can potentially lead to self-harming behaviors or suicide. Depression treatments are effective and allow a person to return to their normal daily functioning. It can also teach people valuable coping skills to help them manage symptoms and other stressors. Myth number 10. Depression is a sign of weakness. Depression is a mental health condition that stems from a chemical imbalance and not from a defect in character. A person does not choose to become depressed. Depression is only viewed as a weakness due to the stigma that society has placed on it and has nothing to do with a person's mental, emotional, or physical strength. Myth number 11. It's all in your head. Depression is a real mental health disorder stemming from biological, emotional, and environmental factors. There are many physical symptoms of depression, including disrupted sleeping patterns, fatigue, aches, and pains. Someone who is depressed isn't simply imagining their symptoms and cannot quickly resolve them. Myth number 12. You can just snap out of it. Getting help for depression is critical to avoid negative consequences. Treatment can allow a person to restore happiness, recapture their lives, and return to normal levels of functioning. Depression is beyond a person's control and directed by larger biological, psychological, and social factors. Developing depression is not a choice, and often, mental health treatment is the only way to pull oneself out of it. With quality care, depression is treatable. It all starts with a call. If you or a loved one is living with co-occurring depression and substance use disorder, reach out to the Recovery Village today to discuss treatment options. That's all for today's video, and I hope you enjoyed it. If so, make sure to like, share, and subscribe to Opti Health for more captivating health-related content. As always, thanks for joining us on this journey. And until next time, stay cool, stay healthy, and stay curious.